So CBT, as the name tells us, cognitive behavioral therapy. We look at the cognition, so thoughts, how they affect how we feel, and we look at the behavior and how it affects how it makes us feel. And I think that the easiest way to illustrate that is with an example. So imagine a situation when you are walking down the street and you wave to your friend, but your friend doesn't wave back. And if you interpret the situation, oh my God, what have I done? They must be really upset with me. They must be cross. Then what happens to you? You start feeling anxious. You might start feeling paranoid. Then what do? You go back home, you ruminate over that, you run over every single conversation you had with this friend to check whether you offended them in some ways. And in the future, you might even start avoiding your friend because you might be scared that there might be confrontation. But imagine the same situation. So you're walking down the street, you wave to a friend, your friend doesn't wave back, but the thoughts are slightly different here. So you think, oh, I wonder whether they are so occupied in their mind that they haven't noticed me. Maybe there's something going on in their lives. Maybe I should check with them how they are. Yeah. So in terms of the feelings, you become more concerned rather than paranoid or anxious. You become concerned about your friend. You go back home, grab the phone, you text, hey, I saw you in town. You haven't seen me. You look like you were too preoccupied with your thoughts. So I just wanted to check if you're okay. So you can see that the same situation, but the way how we think about it is going to affect how we feel. Yeah. And the same with the behavior. Sometimes what we do is going to affect how we feel. If we wake up in the morning, feel deep in bed, then we're going to feel bad. If we wake up in the morning, feel depressed, but we will get up, make the bed, make ourselves a cup of tea, maybe we're not going to feel super happy, but we're going to feel slightly better if we stayed in bed. So this is basically CBT. CBT teaches us how we can view situations differently and how we can do things differently to have different outcome. In terms of EMDR, I love EMDR, and I think that this is one of the best therapies in the world, the most effective, the quickest. So EMDR stands for eye movement desensitization and reprocessing. It's a very fancy name, very simple technique. Basically, it was invented by Francine Shapiro, she was walking in the park once, preoccupied with some negative thoughts, and on her path, the trees were casting shadows. And she started following these shadows from side to side. And she noticed that what she was thinking about became more neutral. So as she was a psychologist, she ran to her lab, started testing it, and she came up with EMDR therapy. With EMDR therapy, there are some elements that are similar to CBT therapy, identifying cognitions and so on. However, I think that the element from EMDR therapy that is the most powerful is actually those eye movements. Yeah. And those eye movements they help us to activate different parts of the brain. So sometimes things that we didn't have an access to, we start having access to. The easiest way to describe that is the example with trauma. So, and it's been used predominantly for treating trauma. When people experience something traumatic, sometimes the processing during the traumatic event in the brain gets kind of like blocked. Yeah. And they've got somewhere in part of the brain memory stored as it happened, but this traumatic event. But it's not processed. They've got in another part of the brain, they've got information, yes, I'm safe now, it's not happening anymore, and so on. But they are not connected. They are in two different parts. And sometimes this traumatic event gets activated, and then they get response like they are almost again at that threatening situation. EMDR allows us to move to combine those two information and bring those information, some other information that we have. And then that helps processing, and we can put it at the back of our mind, and it helps with flashbacks, with nightmares and anything like that. But EMDR has been used as well recently more to treat anxiety, depression, bereavement. It really helps with bereavement. I worked with few clients helping them with overcome bereavement. I'm thinking OCD,
Yeah.
health anxiety, self-esteem. Yes, all those things. EMDR is very, very helpful.
Amazing. Oh, I'm gonna have to book a session or sessions with you. Yeah, I think it's incredible, like you mentioned there about trauma and how trauma is stored within us. And recently, I think this is part of the reason why I've been off work ill as well. You know, I've had some trauma reoccurring from my past, and that's triggered all these other mini traumas from my past that are coming up. And I recently saw a therapist who suggested that I might be experiencing PTSD as well as this trauma experiences. So yeah, I'm really fascinated by looking at that, yeah, and the grief and all of these things. And I know I can think of so many of my clients and listeners as you're discussing this, that method would support them in releasing and feeling safe in their bodies again.
It is amazing because it doesn't only deal with how we feel about the event and the emotions, but as well sometimes that this trauma is stored in our body, and we've got those physical sensations. With EMDR, you can overcome that. And when I work with EMDR and I deal with single trauma cases, so something dramatic happened, but it wasn't for a long time, but perhaps like accident or bereavement or something like that, I get almost 100% recovery rates. So it is very high, and probably I would say this is one of the easiest disorder to treat, but not many people know that you can overcome that, and a lot of people, they stay with their suffering. So for anyone who's listening, if you suffer trauma, definitely start searching for EMDR therapies, because it's something that you can overcome. And EMDR therapy goes very, very quickly. You get results very quickly.
Wow. Yeah. And I think in the world we're living in right now, so many people are experiencing trauma in different ways that could benefit from that for sure. Fascinating. Oh, thank you. Thank you. And yeah, I mean, you can see why the CBT might take a bit longer when you're having to work with the thought, the behavior, in reprogramming ourselves, I guess.
I think that CBT is as well, it requires more effort from you as a client, because you need to think about your cognitions. You need to do some homework in between sessions. And with EMDR, it's actually quick. All you have to do, you have to listen instructions of your therapist, what to think about. Close your eyes, and then you open your eyes, and you just move your eyes from side to side. And that's it. Your brain does the work. You don't have to work really hard. Of course, you're going to go sometimes through difficult emotions throughout the session, but the release from those emotions is almost immediate.
Wow, that's blown my mind completely.
When I actually went to training, initially I was extremely skeptical about the technique. I thought that it sounds a little bit too magical, too hocus pocus to me. But as part of the training, we therapists, we practice that on each other. And when I experienced that first time, I was like, right, oh my God, this is one of the most amazing techniques. And I use EMDR myself quite frequently. When I did my training, I went jot down every single past event where I felt that I embarrassed myself, or where I cringe when I think about it, or any kind of self-limiting belief. And I just went one by one and started processing them. And it was just amazing.
Wow. Yeah, I will definitely be in touch after we're finished recording this for sure. Amazing. And yeah, okay, I guess like personal as well. So I guess you can do this online, can you? Do you do?
Yes, it works very well online. There are some YouTube videos that they've got. My favorite one is a green dot that goes across the screen that I can send to my clients, and then they just follow it while on Zoom call with me, and it brings exactly the same results as therapy face to face.
Okay, I can imagine that a lot of people, once they listen to this, will be reaching out to you. And I will put all of Joanna's details in the comments as how to connect with her.